Dr. Charan on ADHD navigation challenges and embracing strengths. Neuropsychiatrist, KIMS Hospital, Hyderabad. What are the key signs and symptoms of ADHD and how it is diagnosed by healthcare professionals?
So ADHD is a common childhood neurodegenerative disorder. Here what happens is there are three main groups of symptoms. One is inattention, second is hyperactivity, third is impulsivity. First one, when I say inattention, a normal brain can focus up to 25 minutes. Some people can focus up to 45 minutes. But here, depends on the severity, the focus becomes very less. They can focus up to maybe 5 minutes, 2 minutes, 10 minutes. And they get easily distracted by the surroundings.
How does ADHD manifest differently in children, adolescents and adults? And are there age-specific considerations in diagnosis and treatment?
So, the symptoms triad that I told you remains the same between all the three age groups. However, the presentation will be slightly different in terms of if you have ADHD in a child, obviously, you have difficulties, academic difficulties because of inattention. Same thing for an adult, there will be difficulties at your job, employment, and also in relationships that you form. Other than that, the presentation-wise, it is exactly similar. The treatment obviously is going to change. We're not going to treat with the same medications for a child and for an adult. The dosages are different, the drugs are different, the behavioral techniques are different. In children, we use a lot of parental guidance and also the school teachers and tutors guidance. Whereas for adults, it's mostly one-on-one tutoring.
What role do behavioral interventions play in managing ADHD? And how can parents and caregivers implement effective strategies at home?
Parents and caregivers can implement a lot of strategy behavioral techniques to improve the attention and to reduce the hyperactivity and impulsivity. This is the goal. So here, they have to help the child organize the day. If you're changing the day, if there is anything going out of the routine, you'll have to inform the child in advance so they don't lose focus on it. And second is to use rewards. So whenever there is a desired behavior or a good behavior by the child, you have to give a reward. But if you have an undesired behavior, you'll have to use a punishment. Punishment doesn't mean hitting the child. Punishment is maybe timeout. Ask the child to be in a corner for 5 minutes. And next is using a timer. Set aside a timer for every 5 minutes or 10 minutes. Whenever you think your child's brain snoozes, let the alarm ring. So they can take a break and come back to do their work. And whenever you're giving them instructions, don't give them complicated instructions. Don't talk over each other. Instead, give a simple instruction. One more thing is you can do an exercise called bead sorting to improve their attention, where you take beads of different sizes and ask them to separate them and maybe form a chain. So that way their attention gets improved. And also if there is any tangled cord, ask them to detangle it or untangle it. So these kind of exercises definitely will help.
How do healthcare providers determine the most suitable medication for each individual?
So that we do after taking a detailed history and knowing your entire medical history and your family history, because a lot of genetic cases of ADHD also do exist. After taking all of that into consideration, we do run a panel of blood tests, a basic blood panel, and do some questionnaires and determine the severity. Based on that, we provide them treatment choices between two main groups of medications that we have in ADHD, and we let the patient have the right of choice to pick. If you're a major, if you're a minor, obviously we'll take parents' decision on it and start the medication.
Are there specific challenges for adults with ADHD in terms of work, relationships, and how can these challenges be navigated?
Definitely. In relationship, imagine if you're somebody who forgets your anniversary date and doesn't pay attention to the conversation that you force is talking. A lot of miscommunication and fights do happen. There is a phase called love bombing where, because of your hyperactivity and impulsivity, you do show so much of attention and you do a lot of things, buy them a lot of impulsive gifts, etc. But later when relationship takes a stable course, you tend to be somebody who is not paying attention to your spouse. How do you navigate that problem is go for marital counseling and let your spouse understand that you have ADHD so they can understand how to navigate with you. So that becomes easier. At work, the main problem is you tend to forget your appointments, meetings. You might be distracted when you're having a board meeting, etc. Turn your work table towards a blank wall where there are minimum distractions, or please request for a specific cabin which doesn't have a lot of noise or environmental stimuli for you to be distracted. So that way it can be more focused.
Are there lifestyle factors such as diet or physical activity that can influence ADHD symptoms, and how can they be addressed?
So ADHD can get worsened with having high calorie foods and sugars. Even people without ADHD, for example, let's just assume you and me don't have ADHD. If we tend to eat a lot of desserts, or if we drink, like, let's just say Coke or whatever a lot, we don't focus as much. We feel more restless. If that happens to us, imagine somebody with ADHD having the same thing. It will worsen it. So you have to avoid sugars, especially artificial sugars are more dangerous than like natural sugars. For example, if you're having Diet Coke, it has aspartame, right? That is not good. If you're using artificial sugars for your coffee and things like that, is not good. It will worsen your ADHD. So avoid high calorie foods, junk food, maida, baked goods, and artificial sweeteners. Yeah, these I think you have to avoid. And you can have a lot of proteins and complex carbohydrates, not simple. You can have whole grains, a lot of vegetables, fruits, yogurt, milk, foods that are rich in vitamin D, rich in B12. All this definitely help with your attention. And lots of water, not to forget.
What are the potential long-term effects of untreated ADHD, and how can early intervention contribute to better outcomes?
Yeah, so like any other disease, early detection is the key. But unfortunately, in ADHD, what happens is, if your child is hyperactive and restless, people think he's a naughty kid. They don't think they have ADHD, and they never bring to the doctor to diagnose. So it goes unrecognized till their adulthood or adolescence, where they are making impulsive, rash decisions or doing reckless driving, meeting with accidents, using a lot of drugs to calm themselves down, etc. That's when they bring patients to us. So early detection is definitely the key. We can start treatment as early as 6 for the children with the medication. They're absolutely safe. Now, going back to your question, what does it lead to untreated? First thing is, it leads to a lot of accidents. Imagine if you're impulsive and hyperactive. That's the worst combination. While crossing the road, you wouldn't really see. You would skip a signal. You'll bump into another car or meet with accidents. And the second thing is, you'll lose out of employment opportunities. You might get out of relationships because of this, following which you can have clinical depression. That can happen. And third one is, you might feel socially awkward sometimes because you're interrupting others.
How can healthcare providers differentiate between ADHD and other conditions that may present with similar symptoms?
So, inattention being the main symptom, clinical depression is a place where you do see patients with inattention. Vitamin D deficiency is where you see patients with inattention. Or people who are going through any emotional and behavioral disorders also can present with inattention, hyperactivity. And there are some mood disorders where you have mood swings, impulsivity, irritability, etc. So we do obviously take a detailed history and a specific set of questionnaires to differentially diagnose between this condition and the other condition.
How common is ADHD and how it is present in boys and girls?
Yeah, so ADHD is quite common, more common than you think it is. It is 10% common. So 7 to 11 is the prevalence rate. So let's just take an average of 10. That means 1 in 10 children, or if you have a class of 100, 10 children can have this condition. So, a screening in schools is absolute must for this. And boys and girls, how is it different? Girls do present more with the inattention area, and boys do present with hyperactivity and impulsivity area. So that's how it is mostly different. But I'm not saying that's the only way they present. They can present either way.
Embrace understanding, harness your strengths, and join us next time as we continue exploring the diverse landscape of ADHD with expert guidance.